what's the difference between deep cleaning and the regular clean? So let me see if I can explain to you in so many words. So when we do a regular cleaning, there is no damage to bone and no damage to the gum. It's a healthy cleaning. So when we do a healthy cleaning, we're checking your gums, we're checking your teeth, we are removing some mild buildup that you have. We are going to remove the stain. We might talk about some improvements such as maybe whitening. But when it comes to deep cleaning, it's a little different. That pesky bacteria that hiding under the gums, when you maybe skip flossing for a day or two or a year or months, that's where the problem begins. So what we're really going to do is we're going to reduce the bacterial load. My hygienists, who are amazing in what they do, going to get you comfortable, which is very important because people have a misperception about deep cleaning because they think it's going to hurt. So we're going to get you comfortable and we're going to go under the gums and we're going to clean out all of that debris, all of the bad bacteria, and we're going to reduce the bacterial load. That's the big difference between healthy cleaning and the deep cleaning. I get this question a lot. Why all of a sudden I've been getting regular cleanings for years and years and years, and now I need the deep cleaning? Why is it necessary? Listen, number one, I'm in Sarasota, Florida. This is the retirement capital of the world. So we get a lot of snowbirds from New York, New Jersey, Chicago, and they all flock there. And guess what? They've been getting regular cleanings year after year. Now they come down to me and I get this question. So now all of a sudden, why do I need a deep cleaning? So here's what we know. Research shows that half of the people over the age of 30 have some kind of a stage of gum disease. And as we get older, that gets worse, unfortunately. Let's just say it's more difficult to fight the bacteria. Our immune system gets weakened. We need to up our game a lot more. And that's the reason why we went from healthy cleaning to deep cleaning, to gum disease. And so we have gum disease, which basically bacteria invades the gum and the bone. And now my hygienist, and sometimes it requires more, have to go under the gums and clear out all the bacteria, all the infected tissue to allow the healthy gum to reestablish. When you come in to get your cleaning done, what we do is, number one, we do a very thorough exam, which is very important. We try to do it for people who have healthy teeth and gums. We do it at least once a year. When people have been diagnosed with gum disease, periodontitis, every time you come in, we do an exam of your gums. We'll also check your teeth. So like I said, number one, we check. And second of all, we're going to remove all of the bacterial load that's been accumulating over time. So here's what the research shows. Every 2 months, the bacterial amount doubles. So imagine this. You've gone 6 months between the cleanings. So do the math, 3 times more bacteria. We also remove the stain. We double check the cavities. You get a free toothbrush. A lot of people ask me questions. Does dental cleaning painful? Well, guess what? If you have healthy teeth and gums, it should not be painful. Because again, all we're doing is just cleaning out superficial bacteria that's accumulated over time over the 6 months. So no, it's not going to be painful. Okay, your teeth may feel weird, strange after the cleaning. Well, number one, they feel clean. That might just be weird because some people accumulate a lot of tartar, especially in the inside, right where the lingual saliva glands are. So my hygienist will do a thorough job to remove all of the tartar and the plaque from their teeth. So the teeth are going to feel smooth. They're going to feel clean, maybe even a little strange. And also we do fluoride. So that's probably the reason why it's weird. Because when you put fluoride treatment, it feels like wax. So the gums heal after the tartar is removed. What's been happening is that tartar doesn't allow the gums to reattach back to the healthy tooth structure. It's literally creating a crevice for the bacteria to get in there. So when the tartar is removed, then the gum can get back and reattach, and it heals beautifully. And also the color improves because you get from the swollen, purple, bleeding gums to the healthy pink gums. So there are some tips I can give you how you can maintain your teeth clean after the dental cleaning. Number one, basics. Brush twice a day, at least twice a day. Some people prefer to brush after every meal. But again, listen, if you're a busy person like I am, and I'll be the first one to admit, I brush twice a day. Okay? I also definitely recommend to do some kind of a cleaning in between the teeth. Different things work for different people. Some people are great with flossing, with string flossing. Some people like the little flossers you can buy that look like a U, almost looks like a little Nike sign, and they just clean in between the teeth. For some people, water pick, which is a water flosser, works great. That's what I use. To schedule cleaning in my office, you can do several things. You can, of course, pick up the phone and call. My number is 941-921-4654. And my friendly, amazing staff can just schedule this appointment. Sometimes, listen, you remembered after hours. So you can go on our website. We're going to have a contact you, and you can put in your information, and someone from my staff can call you back. So there's multiple ways. You can send me an email. I just want to make sure that your teeth are clean and healthy for the rest of your life. I reviewed a lot of information. I know it's a lot to take in. I hope you picked up a tip or two how to keep your teeth healthy until you make an appointment in my office. You can, like I said, call us at 941-921-4654, email, and guess what? Healthy teeth and gums for life.